The following portion of Living Local DMV is sponsored by Ashburn Children's Dentistry. Welcome back. In part 2 of our ADHD or Airway series, we're diving into how poor sleep and mouth breathing can mimic ADHD symptoms and why dentists may be the first to spot it. Here to help us uncover what the mouth can tell us about behavior and how the right screening could change everything are doctors Lynda and Krystle. Dean Giroux, welcome back to the show.
Thank you.
It's so wonderful to have you here. This is such a compelling conversation. As we mentioned, it's part 2. Please dive back into how some ADHD behaviors might actually be linked to airway and breathing.
So things like inattention, things like hyperactivity, things like that actually can be linked to how well your jaw's developed. So if you have an underdeveloped jaw, it definitely restricts your airway and things like that. And so it can then affect how you're sleeping. So the mouth can tell you a whole lot.
And when we're talking about that, so, you know, as you're speaking about jaw development and obstructed airways, so when we're speaking of our children, so that means interrupted sleep, which can then lead to behavior that looks like ADHD. Is that correct?
That is correct. And a lot of these things are seen early. And some of the things I would like for parents to be thinking about is if they have trouble latching from the beginning. If their children don't have spaces between their baby teeth, that's a problem. And some of the things that we can see in the office are obviously the crowding and the jaws not fitting well, the narrow jaws, or it's the underdeveloped jaws. You can see signs of grinding, we can see signs of mouth breathing, and we can also sometimes see the tonsils are much enlarged on there. Yes, and we see narrow palate, a high vaulted palate like that, and you know, so many things that are evident for a trained eye that can let a parent know that their children may not be sleeping as well.
And what are some of the red flags that parents can look for?
So at home, what they can be looking for is if their child is snoring, if they're cranky to wake up in the morning, if they're constantly mouth breathing, things like that. And it's a huge deal because if their airway is restricted, it's hard for them to have a really good night's sleep. And therefore they can't wake up with good focus and be able to kind of get through their day. And it shows up in kids in different ways, either over hyper or hyperactivity or just very sluggish and lethargic. And so that does definitely over time chronically affect the brain, and oftentimes they then become diagnosed with that ADD, ADHD.
When truly they
could just be lacking sleep, right? And just not being able to breathe as well as they could.
If parents are seeing some of those signs in their children, what should they do for?
Well, the best thing is to find someone who's trained in recognizing that early. And usually it's an airway-focused dentist, because most other providers will say, oh, wait, they're going to grow out of it. But they don't grow out of it, they grow into it. So, for instance, if they're looking for experts, like we're experts in looking for that, they can check us out on our website at kidsmile.com.
It almost seems a little bit cruel or almost negligent to say, hey, they're just going to grow out of it. Well, and in the meantime, they're going to what? Have uninterrupted sleep. It's going to affect their growth. Your body doesn't get enough rest. It's not producing all the different hormones that you need.
You're absolutely right. But I think what we like to kind of get away from is that no provider actually learns this in school. It's about connecting the dots, and we learn how to sort of fix the symptoms as we see them. And so what we're trying to bring awareness to is just being able to kind of step back and just look at the bigger picture and work together with other providers too to be able to help these kids kind of be built from the ground up.
And it's going back to looking for the whys and the root causes and being able to help them thrive.
Looking at it from a holistic
yes. But again, we don't, it's not something you get taught in school. And we got to look at, you know, even medical, even though we all go to school for a really long time and work really hard in that kind of boot camp, is understanding that what we learn, there's so much more to learn, that the human body is so complex, and the way it connects is also very complex. That we all need to kind of that needs to change as far as schooling goes.
Absolutely. Well, if there are parents that are watching, how can they get in touch with you if they feel like they're seeing some of these signs in their children?
Sure. It's our website, www.kidsmile.com, Ashburn Children's Dentistry on Instagram. They can follow and subscribe. Lots of information there.
Okay.
Our phone number, 703-723-8442. 8440. That's a private line, so you could call that too.
And then we have the flow code right there on the screen for our viewers as well. And you guys have an event coming up.
We do. So just like we were talking about with providers having an understanding, we're having a provider event where we are going to be kind of gathering all kinds of providers that help maternal, that are in maternal health. They help children and pediatric patients. And so we want to kind of talk and kind of give more an idea of how lasers and Airway see how it works in real time and things like that. So
just helping them get more awareness themselves, and also see what to recognize early, what signs they can see early enough to help the children that they see.
And as you said, just having that conversation with other professionals.
The collaboration is so important.
Yes.
Yeah.
Well, thank you for all the work that you're doing. Thanks for joining us today and getting us up to speed.
Yes,
Thank you
it's a
so much.
pleasure.
It's always great to have you.
Thank you.
The preceding portion of Living Local DMV is sponsored by Ashburn Children's Dentistry.